Shadow Health Secretary is with us now. Hello, good morning. You heard there the nurse saying that potentially nurses are looking at strike action because they are burnt out, they need more money, they can't cope.
Well, do you know, in more than 100 years of their history, the Royal College of Nursing has never balloted for strike action, let alone taken strike action. And what was striking about that clip we just saw is it reflects what so many nurses have told me over the summer, what the President of the Royal College of Nurses has told me, which is that, yes, of course, nurses are worried about pay and terms. Lots of people are with the cost of living crisis. But there's a fundamental concern they have, which is working on understaffed shifts, feeling exhausted and burned out, and worst of all, going home at the end of a long day worried about whether or not they were providing patients with the quality of care they deserve, suffering a moral injury because of the staffing crisis. So unless the Health Secretary grips that staffing crisis and sets out a plan to recruit the doctors and nurses that we need, patients will continue to wait longer for care. And I think after 12 years of this, it's clear the longer the Conservatives are in power, the longer patients will wait.
But we've heard from the Prime Minister, and we'll hear from the Health Secretary later on today, that the NHS is right at the top of their inbox.
Well, if their policy is so good, why hasn't the Health Secretary come on your programme this morning? Why is she in hiding and avoiding media scrutiny? I think it's because she knows, from what I've seen trailed overnight, that the problems or the solutions she's presenting to the biggest crisis in the history of the NHS are barely sticking plasters. They're not persuading NHS leaders who've come out today and said it won't be enough. I don't think it's going to persuade patients. I mean, can you believe it? After 12 years in government, they're saying, great news, you'll get a GP appointment within a fortnight. I mean, 2 weeks. We guaranteed GP appointments within 48 hours when we were in government. And asking the Conservatives now to fix the crisis in the NHS is a bit like expecting an arsonist to put out the fire. They've caused these problems over the last decade. They don't have the answers. And frankly, unless they fix the workforce challenge, recruiting more doctors, more nurses, we're not going to get patients the care they need in a timely way.
But Shadow Health Secretary, we have an ageing population. More people are over 65 than under 16. More people need to be seen by a GP. We don't have enough staff. The government has said they're looking to bring in 6,000 new doctors before 2024. They're doing what they can.
Well, they've admitted that they aren't going to meet that target. They've neglected to mention they've cut almost 5,000 GPs in the last decade, and 330 practices have closed since the last general election alone. Where I would agree with your analysis, Kay, is, beyond the demographic pressures, we've got to look at the long-term future. I'm clear about what that means. It means gripping the crisis, recruiting the staff that the NHS need now, and also looking longer term at the model of care. Well, I think in some cases, particularly in social care, the government's already said they're going to invest in social care. I think they should use some of that investment to improve pay and conditions for staff in social care, because what we find is that care workers are leaving the profession to go and work for the likes of Amazon because they pay better and they have better terms and conditions. And let's be honest, Amazon are hardly famous for their workplace terms and conditions. And that's why we've got more than 400,000 people who are well enough to leave hospitals, stuck in hospital beds every month that could be used by other people for no other reason than social care isn't there.
I wonder how you go, if you were in government, how you would start to pay for all of this. I mean, you talk about a windfall tax on oil and gas companies, doing it on the back of an envelope. It's going to cost something like £29 billion, according to Secures emergency plan to stop energy bills rising over the winter. This windfall tax would raise something like £2 billion. You'd have to loan money, wouldn't you? Borrow money, I should say.
No, all of our policies are being costed, and every time we make an announcement, we explain where the money would come from, how we would pay for it. That's in stark contrast to Liz Truss, who seems to now believe in magic money trees, who is resorting to borrowing, isn't being honest about how she would pay for the things she wants to spend money on, and worst of all, is pursuing policies that may well be inflationary. So instead of gripping inflation, bringing inflation down, which will be the most effective way to deal with the cost of living crisis, growing the economy so that the answer isn't always to pull the lever on tax and to charge working people more, which has been the hallmark of the Conservatives' tax and spending policies for recent years and sluggish growth for more than a decade now. We're very clear. No borrowing for day-to-day spending. That's there in our fiscal rules. We've got a big investment plan that would help get the economy growing. Rachel Reeves and Keir Starmer will be saying more about that at our conference next week. But, my promise to your viewers is that when we pledge to spend money on investing in our public services, for example. We'll explain where it comes from. And most importantly, we're going to tax fairly and spend wisely. That's a stark contrast to the irresponsible approach we now see from Liz Truss's government.
OK, what's top of the agenda for your party conference, which starts this weekend?
Well, I think Britain needs a fresh start. We've had a Conservative government for more than a decade now. We've got to look at how we build a fairer economy. We've got to look at how we grip crime and provide genuine law and order, which I think has just spiralled out of control in so many communities. And of course, in addition to the cost of living crisis, there's the biggest crisis in our country, which is the crisis facing the NHS. We're going to have lots to say on those issues next week. And I think by the time that Labour conference concludes, more people in the country will conclude we've not only got the right team in the Labour Party, but the right policies and values to meet the challenges facing our country. And surely, after 12 years of this government and their abysmal record of failure, it really is time to change.
Let me ask you about a fringe meeting that is about abolishing the monarchy. I brought it up on Twitter the other day and they were very cross with me. Don't care, frankly.
That's not like UK.
No, I know. Can you believe it? Do you think it's a good idea for something like that to go ahead?
Well, let me say, as a staunch monarchist and a believer in the monarchy, I'm not afraid of the debate, actually. 2/3 of our country, last time I checked, support the monarchy, can see the benefits it brings to our country, admittedly against the extraordinarily sad backdrop of the loss of the Queen. We saw at that funeral last weekend just the most remarkable display of what it means to be British, of pride in our country, pride in our Queen, pride in our crown, and the soft power that the royal family can exercise in the interests of our country. Now, I think that's preferable to having some elected president. I don't think an elected head of state would have got anything like the response or affection that the Queen generated during her long and magnificent reign. But I'm not interested in shutting down the debate. I'm not frightened of the debate. I'm not offended by the debate. I'd happily have that debate, and I think the majority of the country agree. And I just respectfully disagree with the minority that don't agree.